You know, sometimes in medicine you see these cases and they just make you stop and think.
Yeah.
And we got a request from a listener to do a deep dive on this case of Dorothy Miller, a 55-year-old high school clerk from Orlando, Florida,
Okay.
battling hairy cell leukemia.
Oh, wow.
And there's some pretty interesting elements to her story.
Interesting.
So Dorothy, she was diagnosed with hairy cell leukemia a second time back in March of 2011.
Second time.
Second time. And they gave her a pretty difficult prognosis, said 6 years with treatment, maybe less without it.
Oh, wow.
But here's where things get tricky.
Okay.
Her insurance, it wouldn't cover in-hospital chemo.
Oh, no.
So she had to manage this whole complex treatment at home.
That's really tough. I mean, hairy cell leukemia, it's a rare blood cancer, right? It
Yeah.
affects your white blood cells.
Yeah.
And chemo, that's the standard treatment. It's designed to kill those cancerous cells.
Right.
And usually that means you're going to the hospital, getting it intravenously pretty regularly.
Right.
But Dorothy's case, she's kind of thrown into this new world of at-home treatment.
Yeah, it was pretty uncommon back then, too.
Definitely.
So you've got Dorothy battling this serious illness, managing chemo from home, which you can imagine comes with its own set of challenges.
For sure.
But here's the thing. Here's where the story takes this really wild turn. Dorothy, she experiences this rapid, complete remission.
Wow. Seriously?
Seriously, her doctors, they even called it remarkable,
That's amazing.
especially considering she was their very first outpatient chemo patient to do this. And without a blood transfusion, too, which, isn't typical in these cases.
That's incredible.
So it really makes you wonder, right, what factors played a role in such a positive outcome.
Right. You got to think about that.
The sources we've got, they point to something Dorothy was using called Cellular Healing Therapy for cancer. She incorporated this into her treatment plan. Listen to these recordings 4 times a day.
Cellular healing therapy. Interesting. So it's not replacing the chemo, right? It's like a complementary approach.
That seems to be the case. It seems to focus on cultivating a positive mindset,
Right.
potentially influencing the body's healing mechanisms.
Makes you wonder about the mind-body connection, right?
Absolutely.
It's just one case study, though, right? We got to be careful about drawing too many conclusions from this one example.
Oh, definitely. We can't say for sure that this therapy was the sole reason for her recovery. But it's a fascinating piece of the puzzle, right?
For sure. It definitely raises some interesting questions.
The sources do mention a Dr. Lon Anderson, who apparently introduced Dorothy to this cellular healing therapy.
Okay, yeah.
If any of our listeners are curious about learning more, Dr. Anderson's a psychologist with a pretty diverse background. He's worked at Eastern State Psychiatric Hospital, the Knoxville Job Corps Center.
Wow.
You can reach him at Zoom Wellness Labs in Nashville, Tennessee.
Nashville.
That's 309 plus Park Boulevard, Suite 261, zip code 37217.
All right, so Nashville.
His phone number is 629-278-2163, and his email is lona32452@gmail.com. But as always, we want to remind everyone that while these individual experiences can be super compelling, it's important to approach alternative therapies with a healthy dose of skepticism. Talk to your doctor, your qualified healthcare professional.
Definitely. Always good advice.
Dorothy's story, though, it really leaves you thinking, right? Could her mindset, her use of this alternative therapy alongside conventional treatment, could that have impacted her body's response to chemo?
I don't know. It's a fascinating question.
Maybe it was a combo of factors, maybe something else entirely. It really makes you think about how complex healing is, that potential interplay between mind and body, the things we don't fully understand.
Yeah, there's definitely more to learn.
More to learn for sure.
Uh,
Thanks for joining us on this deep dive.
yeah, thanks for having me.
We'll catch you next time.
See you later. Bye.
Bye.